right, just about 5 minutes after 11 o'clock. Nice-looking Wednesday. It's Halloween. I don't know how many of you celebrate, but I know we've got candy here. That's all I care about. Dr. Riadh Fakhoury is here. He might not approve of that candy. This is
I'm
the
not
head
a dentist.
But you were going to be. You're heading in that direction.
That's right. You remember.
This is the Head to Toe Care Show, and if you have a question about your body, I'll just put it that way. If it's somewhere between the top of your head and the tip of your toe, call up and ask about it. Dr. Fakhoury can either tell you where you need to be to take care of that. I didn't want to say where to go because that sounds rude. Or perhaps give you some direct information. And today Rob is in the studio because we're going to talk a little bit about the chiropractic and medical center that Dr. Fakhoury has founded here in Ocala. And that is, by the way, at 1009 Southwest 16th Lane. And the phone number over there, 351-3413. Call right now. This number, though, if you want to speak to Dr. Fakhoury, the number is the Climate Control Source Hotline, 622-9622. There you go.
That's right. Well, it was really an honor having the two of you come in about a week and a half ago and visit with us at the office and see our facility over there. You were like honored guests. It was a pleasure, and you had a chance. Anna had a chance to say hello and visit with you.
Yeah, it was a great visit. Had some mental notes I was taking for people in my own family. They've gone through a couple of different things. That I was thinking, wow, this would actually help him or her or whatever. And I think the thing that floored us, the first thing, was when we took a left, went into that room with all that exercise equipment or therapy.
So you went into the rehab therapy first?
Yes.
They took you to the left.
Yeah.
First the front desk, then off to the left. Then.
Yeah.
Very good.
Yeah.
Very
and
good.
of course, no, and I take that back. The first thing that impressed me was the friendliness of the people. And the great TV show that was going on, by the way.
I know what show that was also.
Yes.
And it was really amazing because some people were using the therapy equipment and some people were being given some kind of treatments in other rooms. And we could hear members of your staff, your professionals, speaking to the patients. And it was just like they knew each other forever. Very relaxing kind of conversation.
It's amazing. Travis, Brady, and Tyler in the rehab department, because most patients will go there first, in that the rehab helps to restabilize that area. There's some weaknesses in the spine, and we could adjust all day long, but if we don't strengthen the structure around there, the bone will slip right back out of position again. And they do such a wonderful job of building a rapport and relationship in the healing process, because people don't really want to be stretched and they don't want to this and that, but they make it fun and they interact with the patient and make it more enjoyable.
And when you say strengthen the structure,
yes,
do you mean could we replace the word structure with the word muscles, or is it more than just the muscles that get strengthened?
Well, the structure is the body, because
the
structure could include your posture, it includes your balance, it includes how strong the ligaments are, which is the rubber bands that hold the bones in place and keep them from slipping out of place. It includes the muscles also, which help you to stand erect and move and bend from left to right and twist back and forth. So there's a lot of the things that they're working on. They're stretching parts of the body, and they're strengthening parts of the body, and they're teaching you how to use parts of the body, giving you some home exercises to help. Because remember, when an individual comes, we're not a specialty that just looks at a section like the eyeball or the ear.
Right.
But we're looking at this whole structure, which is the spine or the joints or the ligaments or the muscles or the nerves, and how they interact with each other, and how do we approach them to allow them to hold their adjustments and their treatment longer.
And every week when you're here, you talk to us about all the different skill sets that the different doctors offer. And when we actually walk through your office, we kind of got to feel, oh, this is where that doctor is, and this is where that therapist is, and had a better understanding of how it's all laid out, and how you might get care from one or all of the doctors that are there.
And we see that the patient's sometimes a little apprehensive, but when they walk in and they start meeting and greeting and putting names and faces together, by the end of that first visit, the whole attitude, the comfort level is there, and the confidence is there in the patient, and then that sets the healing process in the right direction.
And I got to see the faces in person of the Facebook people.
Right.
Because is it your wife who puts them on Facebook, or somebody else?
Yes.
So I get to see them a lot now and then, especially. And you on the scooter the other day. That was
well. We've got some costume pictures coming up soon. So
you
keep
do?
an eye at the Head to Toe or Fakhoury Medical and Chiropractic on Facebook. Did you get a chance to meet Dr. Shanawani, our medical doctor?
No, but we saw his
His office and his
office.
area.
Okay.
Yeah, his area. Yeah.
Well, we'll have to invite you back and get a chance to say hello.
Anna told us some great things about him and what he does and the type of treatments that he will give people. And they are so... those kind of treatments you wouldn't even think that a general practitioner would do, and it's so refreshing to know that there are GPs out there that will pay attention to the whole body, even from a simple sprain.
Right, and the nice thing with Dr. Shanawani, he's so caring and very loving, very compassionate physician, and he'll sit right there with you and he'll talk to you and interact with you, because that's where the healing starts, is in that communication between the physician and the patient. And there's a lot of things that he has to offer, and what fits so well with the Fakhoury Medical and Chiropractic Center is that he has GP background, he has surgical background also, but his focus is he's had 25 years of urgent care emergency room experience, which fits perfectly, because instead of focusing on heart and lungs and blood and stomach, those are the things that we refer out to because we don't do general practice. But when it comes to muscles and sprains, strains, and disc problems and hurt necks and backs, that's where he excels, because his emergency room background has allowed him to see all of it. So with that, he's found detached retinas, he found a lacerated, it was either liver or kidney, and that was life-saving for the patient because they airlifted him to Shands after he found that.
Wow.
So
wow.
He adds a whole nother avenue to our trauma care for those patients that have been in accidents that come in. Not only are they seeing the chiropractor, but they're also seeing a doctor, a medical doctor experienced in trauma, that we all look at things from a different perspective, so we cover all bases that way.
You know, I had a friend call me this morning while I was putting together my news, and he was in the hospital. He said he had some internal bleeding. I said, well, what happened? Did you pass out? And he said, no. He became dizzy, went to the doctor, and they discovered something was up. Had an accident and didn't realize that he had some internal bleeding from that accident. I guess it was a week ago or so.
Right.
So there you go. I mean, that could have, who knows how long that could have gone on.
And we sort of nip those things a little earlier because they do get that medical evaluation in chiropractic right up front. And those more and more, now patients used to wait 2-3 months before they would come in. Back when we started 25, 27 years ago, now we see them the same day of the accident, the next day of the accident, so we can catch those things earlier, because once in a while there's those very critical things that need to be addressed.
Your office is very bright, the personnel is very cheery, and you also have posters on the wall from different community events for public service that you and your staff and your family undertake, and that's refreshing also to see that you are truly community oriented.
We love Ocala. Ocala is isn't it a wonderful place to live?
Yeah,
it's
it is.
Beautiful. It really is.
And the other thing I wanted to mention about our tour of the facility was that when we were speaking to Anna, she was talking about massage and how it's. And I know this almost sounds like I should have had this sink in before hearing it, but you know when you hear about massage, it's often a relaxing kind of a thing.
Right.
But I didn't think of it in terms of moving unwanted fluids, like if you have a buildup of fluids in your ankles or in your arm or whatever.
Yes.
Of how that actually helps physically to relieve the pressure from that.
Right. There's two types of massages that are done in our office. There's the 1-hour massage, which is the more effleurage, the feel-good, the relaxation, the soft music. But then we also do the medical massage, which is about 15 minutes long. You know, more of a deep myofascial release, it's called, where we go after the fluid, the edema, the swelling, where we go after the trigger points, which are the muscles that have been spasmed for so long, there are nodules in them, and we loosen up those nodules, soften the muscle, relax the muscle. So when Dr. Joe, when Dr. Teeter, when myself do the adjustment, it's so much easier, and you're not fighting with the muscle because the muscle's relaxed, and then the adjustment stays in place much longer that way because the muscle's not going to pull it right back out. The muscle's warmed and relaxed.
And if the pain is, if the pressure is bringing some kind of a pain, does it go away right away, or does it take a while for that to...
Most patients feel better from their very first visit. I would say 90% of the patients will feel improvement from the first adjustment. And there's so many different things that our great massage therapists work. We have about 10 massage therapists that are on the floor at all times in the office. And, for example, we've had 2 cases of plantar fasciitis or heel pain. So they'll get in there and they'll work that heel and that plantar fascia, and that'll make a world of a difference. Same with tennis elbow, shoulders, neck and back, and definitely for those patients that have been in car accidents, because one of the reactions after a car accident is tight muscles that they think they're protecting you, but they're actually working against you, so they need to be relaxed.
We have a telephone call, Doctor, and for everybody out there who would like to also ask the doctor a question, you are welcome to do so. The number is the WOCA Climate Control Source Hotline, 622-9622. Good morning. You're on the air with Dr. Fakhoury.
Yes, good morning, doctor.
Hey, good morning.
Very good. Say, do you ever use hot water or water for therapy, like a whirlpool, spa, something like that?
Yes, we use that at times, not too often, because most people that are coming in are in an acute situation or a new occurrence where there's swelling.
Yeah.
And so when we have inflammation and swelling, the first thing we recommend is the ice to bring the swelling down.
Yeah.
Now, if it's more chronic, like muscle spasms or arthritis, then at that point, then we'll tell them use the jacuzzi, use the tub with some Epsom salt.
Yeah.
But don't let those jet streams hit you. Like, for example, if somebody has a back pain in between the shoulder blades, they'll put the jet stream right on that area. Well, you're pounding on that muscle, and that muscle is already irritated, so the only thing you'll do is cause that muscle to tighten up more.
Oh, wow.
You'll feel good when you're in there, but when you get out 1 or 2 hours later, when the warmth subsides, then that pain will show up from that muscle that's been over-irritated, overstimulated.
Yeah. Is cold water ever used?
Cold water, not too often.
Yeah.
Sometimes when it's like the whole foot is swollen, we'll tell somebody to actually put ice and water and stick their foot into like an ice bath, and put their foot or put their wrist and their hand in the ice bath so it covers the whole area. But we don't do that for more than 3 to 5 minutes. That's the maximum that you would do that.
Yeah. Do you have the whirlpool and spa at your facility?
We don't. We don't
You
have
don't.
the hydrotherapy. If we need to do any type of water therapy, we'll refer out to a facility that has that, because that takes special circumstances.
Right.
And most times, the people coming into our office at the Fakhoury Medical and Chiropractic Center are more acute and more, I just hurt my back in the yard today, or else I just got in an accident yesterday, and they're coming in with more inflammation. The water therapy would be good for people with hip problems.
Okay.
Would be good with people that have had a chronic condition, maybe some treatment for stroke, some treatment to re-strengthen parts of their body. So those would be some good indications.
Yeah.
About 90% of our patients coming in will be more acute in nature, which we wouldn't really have the call for hydrotherapy. But if we need, we do have the hot pack therapy, the moist hot pack therapy, and we do have something called diathermy, which is a very deep heat that occurs from the inside out, almost like a microwave. It heats you from the inside out, so it's very good in certain muscular areas or joints that do need heat.
Yeah. Do you have to be concerned about people with high blood pressure when you're doing heat treatment?
Yeah, there are some things we want to be careful with. Blood pressure is one thing with therapy that we look after. Also, things like diabetes or peripheral neuropathy. For example, we put electrical stimulation on a person's foot, and they had peripheral neuropathy and diabetic neuropathy. They couldn't feel it, so that's why our staff is trained not to turn it up to where they feel it, because it would be too much for that body part.
Right,
so you have to, even if the patient doesn't feel it, sometimes you have to go to a certain limit. But there are things that we look for. We look for pacemakers. We look for pregnancy. We look for different things, cancers, tumors, skin rashes, high blood pressure. Those are things that we look at when we're caring for the patient, and we will meld the type of character of treatment specifically to that patient and what they can and can't have.
Right. Okay. Well, thank you very much.
Thank you for those questions.
Yeah.
I appreciate it. Bye-bye.
Does an unborn baby experience trauma, like if the mother is in an accident, the mother-to-be?
There's a connection. As you know, if the mom gets nervous, the heartbeat goes up of the mom, the heartbeat of the baby goes up.
Oh, I didn't know that.
Everything transfers through the blood-brain barrier, will go through into the placenta, into the baby. And so also the mother's emotions, because there is a true connection between that mother and child that we don't understand. A mother could be in one room, a child in the other room, the child gets hungry, the mother feels it and knows it and can go. So when the mother is under stress emotionally, physically, it puts the stress on the baby also. That's why it's so important that when the mother feels better, then the baby is more relaxed and in a healthier state. So quite often with moms, because we have either moms listening to the show, or we might have grandparents that have daughters that are going through their pregnancy. Very often what will happen is the sacroiliac joint will go out of position, and that will cause sciatica because of the weight of the baby and the movement of the ligaments and the stretching of the ligaments and the waddle of the walk. And a lot of ladies will actually have back pain and leg pain and sometimes pubic pain related to their pregnancy. Sometimes foot pain, sometimes hand numbness also because of the swelling. But those are things that we can quite often take care of at the Fakhoury Medical and Chiropractic Center naturally, holistically, to help them, so mom feels better, and then the baby's under less stress, and it makes for a much more comfortable pregnancy and a more effective labor also that's less stressful on both.
And are they treating things for a mother to be that, or do they stop the treatment of things, I guess, once you become pregnant? I know a young lady who told me she was borderline diabetic. She's not that old.
Right.
But she was having some kind of what's the pain in the sole called again?
The plantar fasciitis.
Okay, and is that connected somehow to diabetes?
No, the heel pain is usually, it could be because her foot is getting flat from the relaxation of the ligaments and the extra weight on the foot, and she's getting a stretching of the tendon on the bottom of the foot. That we can work with the massage, with ultrasound, with a little support under the foot. We could take care of that for her.
So that wouldn't have to wait till after the birth, right?
No, we have many patients that are coming in through their entire pregnancy up to the labor also, and we have tables that accommodate. And remember, the chiropractic is safe, it's natural, and it's effective, and it can be done on children, and it can be done on pregnant mothers also.
Wow.
And that's the time to help them also, because they're having pain during that time.
So she's maybe making a mistake. I'm just going to tell you, I think she went on to the internet and kind of diagnosed herself. So she was assuming that the pain she was referring to was from borderline diabetes and didn't think she could go until after the baby was born.
Tell her to come in, let us evaluate her. Like yesterday, I had a young man, 17 years old, and he was thinking that his problem was a hamstring sprain and pulling in the hamstring, and what it actually was a pinched nerve. His low back, the disc slipped, put pressure on the sciatic nerve, and it's actually sciatica that he's feeling to his knee, not a hamstring pull. So sometimes people will will try to figure out what's going on, but we have to help in making sure that the diagnosis is correct. So when she's having pain in the bottom of the heel, it's probably a plantar fasciitis, something that's easily taken care of. Diabetic neuropathy will cause a numbness of the foot, lack of sensation of the foot, which is different than pain in the bottom of the heel.
Okay.
And one we can help, one we can't. What happens as the mother is gaining weight is that cells change their shape, the pancreas has different stress on it, changes in the hormones, and so some of the ladies that are pregnant will go into a diabetic period during their pregnancy until they get back to their normal status after the pregnancy. And then at other times we watch for eclampsia and increased toxicity and increased blood pressure. That's something that's very important. That's why a lady who's pregnant will go to her family physician, her obstetrician, and they'll take the blood pressure every time and the sugar to make sure that the sugar is not getting out of control into diabetes, and that the blood pressure is not getting out of control. We have to watch the blood pressure very closely and monitor that closely on some patients.
If we're kind of like borderline health nuts, and what I mean by that, let's say we go to the health food store and we get the supplements for the knees and the joints and all that stuff, and the other ones that are out there too. And then we have a donut or a candy bar or something like that. Does eating poorly sabotage eating well? I know this is not what you normally talk about, but
when you eat well, you're helping yourself, so you're counteracting some of the bad things that you're doing. But going into the health food store is like going into the supermarket. You have a smorgasbord of things you can choose from.
Yeah.
You can choose 5 of one item. And so when you go to the health food store, you find the same scenario also. So we have patients that will come to us and we'll guide them in the nutritional aspects and recommendations for them, because everybody has different nutritional needs depending on their health status, and we will either give them some things that we do have available at the Fakhoury Medical and Chiropractic Center, and things that we don't, we'll guide them and pinpoint so they don't leave with a whole bag of vitamins and minerals and supplements that might be excessive and costly, and they may not need all of that, or there may be interactions with taking too much of one item. So what we'll do is give them guidance and tell them what to go and get, and they can pick that up at that point. So we can help consult with that.
You are tall, and we have that in common. Have you ever experienced this? And I hope you're not going to tell me I got something wrong. If I step into the bathtub, which is cold,
yes,
it's a microsecond before I actually feel it. I know before I can feel the cold. I feel the bathtub, the pressure, but the cold is like, oh, there it is. Does that happen to you?
A microsecond?
Yeah, I guess so. I mean, does that happen?
Because it has to travel all the way to the top?
That's my conclusion. Am I right?
Well, no, the nervous system is very quick. For example,
so mine is slow.
If an ant crawled on your toe, you'd probably feel it immediately.
Okay.
Cold and heat come through different nerve endings than soft touch or light touch. Light touch will travel faster to your brain than cold and heat.
Oh, okay.
And so you'll have your light touch is your fastest, then the cold and heat, and then after that will be your deeper pressures, like inside the muscles and the bones and things within. And that's because the thing that's most detrimental to your health will travel to your brain fastest.
Okay, so I feel the bathtub, but not the cold, and then I feel the cold. And that could be true for somebody who's really short, too. In other words, my conclusion that it's because I'm tall means nothing.
It's almost like turning the light switch. If you have two-room width or a single-room width, when you turn the light switch, it turns on so instantaneously that it's so fast that there won't be a difference between short or tall.
And we have another phone call. Good morning. You're on the air with Dr. Riadh Fakhoury.
Hi there. I came online in the middle of your program, so I might miss something. Plantar fasciitis. You said it's an easy thing to take care of. I had had 3 different injections. Is that considered easy?
Well, the plantar fasciitis could be terrible. It could last 6 months to a year. It could be debilitating. If it's not treated properly, then it could lead to a heel spur and scar tissue in that plantar fascia, and it could be very painful. But most cases of plantar fasciitis being treated correctly could respond very quickly and very easily. And usually, I find that injection therapy is the last resort, and usually, very rarely will people have to go to that point. So if you started with injection therapy first, you put the cart before the horse. What I find that helps the plantar fasciitis the best is several things that we do at the Fakhoury Medical and Chiropractic Center. One thing I do is balance the pelvis. If your pelvis is off, one hip is high, one hip is low, your leg length, you have a discrepancy in your leg length, one leg is long, one leg is short, that puts stress on your foot. So first thing we do, make sure that you're balanced in the pelvis. Second thing, make sure the ankle is adjusted, because we can manipulate the ankle joint. Make sure the ankle is moving freely so there's less stress on the bottom of the foot. And then the third thing is ultrasound to reduce the inflammation at the bottom of the foot. The fourth thing is very deep massage therapy into that area, which our massage therapists are trained to do. If that doesn't work, the fifth thing is that we have a method called Graston, which reduces the nodules and the inflammation and the spasms in the bottom of your foot. And the sixth thing that we would do is, most plantar fasciitis is related to flat-footedness. We would actually cast and make an orthotic or an insert in your shoe that will put the arch back in your foot and relax that tendon on the bottom of the foot that's being stretched. If we do that protocol, the majority of the cases will get better.
Okay, we went from the injections right to the orthotic devices, which were really just Dr. Scholl's.
And the Dr. Scholl's are nice, but they're just like grabbing reading glasses from the supermarket versus getting your eyes checked and getting something specific for you, and that makes a big difference. What we do at the Fakhoury Medical and Chiropractic is, when we have your foot, we actually take measurements, we cast it, and we send it to a laboratory, and the laboratory will manufacture an orthotic made and prescribed for your foot specifically in your condition. And what I would like to do also is take a side view x-ray of your foot and see if there's a spur that's starting to form. But you're missing out on the physical medicine component of it, which is making sure that the spine is balanced, making sure the ankle is moving, and making sure that the actual fascia or the muscle and tendon at the bottom of the foot is being addressed and being treated.
Are you Medicare accessible?
Yes, we are.
All right. Thank you very much.
Thank you very
All right.
much. It's a pleasure.
Sounds like he's not healed yet. It sounds like he's, well, not to make a pun there, but it sounds like his heel's still hurting.
Right, and part of the advantage of the Fakhoury Medical and Chiropractic Center is at the facility we have the physical rehab, we have the massage, we have the chiropractic, we have the medical, and we also have the interventional medicine for the injections. So if somebody needs the injection first, we'll do that first. But if they need more of the physical medicine and the conservative approach, we could take care of that. And maybe we'll touch a little bit on it because there's been so much in the media about the epidurals and the facet blocks and the injections, is that at the Fakhoury Medical and Chiropractic Center, we do the epidurals, but we're not on the list of the centers and clinics that are having problems because we use a completely different laboratory. Our laboratory source is completely different, so we don't have any of those concerns that some of the other offices are. So we're not on that list, and our supplier is completely different.
Wow, I'm wondering if I need to see about my heel. When I drive long distances, I always blame it on the fact that my heel's in the same spot for a while. Then I get a heel pain.
The signs of a plantar fasciitis is very simple. You go to sleep, you wake up, first step in the morning, feels like a needle going into your heel and the bottom of your foot, or you sit for a long period of time at the computer or driving, and you take that first step and you feel that heel pain. As you walk further, it goes away.
Gets better.
But the problem really doesn't go away. It just stretches out. And the reason being is, remember, we said most plantar fasciitis is because of the stretching of the bottom of the foot. So when you sleep, what happens, your foot sort of curls up and gets tight, and that first step stretches it out suddenly and pulls that fascia or that tendon, that muscle at the bottom of the foot, giving you that immediate pain. But the plantar fasciitis is just one of many things that we treat that's musculoskeletal. When we say musculoskeletal, it's anything from bones, muscles, ligaments, neck, mid-back, low back, trauma accidents, and we would like to get those trauma accidents taken care of right away, whether it's a sports injury, yard injury, a car accident, because if we don't take care of it early, then it's going to be something that haunts you later on. Since it's Halloween, we can say haunts you. It'll haunt you a little later on, and it'll trick you, and it'll give you a bad treat, and then you'll end up coming at the Fakhoury Medical and Chiropractic Center, but it's chronic by that time. It would be so much better to get it earlier on.
Oh, okay. I was hoping we could confirm that my heel pain was from my driving. I could use my auto insurance to pay for it.
Well,
not gonna happen, huh?
I don't think so.
Doctor, how do we get a hold of you?
Well, you can call the office at 351-3413. That's 351-3413. Fakhoury Medical and Chiropractic Center. We're on 17th Street between 200 and between 441, just at the bottom of the bridge. There's a light there, a tan building on the right-hand side, Monday through Saturday. And when you call the office, 351-3413, press 4, and that will take you to our patient care coordinator or our office to answer any questions that you have, whether it's insurance, scheduling, whatever you might have, and we'll get the doctors to see you immediately.
And just as the program is called Head to Toe Care, the office that Dr. Fakhoury has set up is front door to every spot. I mean, you've got it all covered. Just as the show title implies, so does your office. Everybody's nicer, is what I'm trying to say.
Thank you, and thank you so much for coming and visiting us, and we hope to have you back again.
Yeah, maybe I'll come for my heel, because every time I drive, I think I got to go see you. All right, I mean, long distances. All right, we'll take a little break and be right back.
Are you experiencing pain in your neck, head, or back? Have you been in a recent accident or injury? Get your questions answered by me, Dr. Riadh Fakhoury, board-certified chiropractic orthopedist at the Fakhoury Medical and Chiropractic